am Dr. Salvador Vargas, and I've been in the field of oncology for nearly 50 years. I have centered in what's called the integrative treatments, which consist of combining best of the conventional treatments and the best of the unconventionals. One of the advantages of using integrative treatments is that for a certain individuals, it's most convenient to start one way and to complement or supplement with the other. And for palliative treatments or treatments that go beyond what we consider initial approach, it's best to integrate mostly with the unconventionals. One thing that we have to keep in mind is the principle of doing no harm. When you use conventional treatments, most people think, that it's going to be harmful, deleterious to the patient, but it's not. It doesn't have to be that way. Our main goal is to eradicate the cancer, but there is a limit as to when you can approach that treatment. You see, otherwise, when it goes into a chronic condition or you have a recurrence, then the palliative treatment is the next thing to follow, but it's a little more cumbersome and lengthy. For example, on early stages of a disease, 1, 2, 3, let's talk about, for example, breast cancers. You can eradicate those. It's not difficult to eradicate them. It's only when they get into stage 4 when the treatment has to be palliative. You have to patch here and there, and you are going to offer the patient, quality and quantity of life. And I believe that there is a way of doing this too, but never lose track of the possibility of, at a given moment, achieve remission or better off, to eradicate the condition. The treatments don't need to be harsh. They just need to, for example, on early stages of breast cancer, what we do is we eliminate the microscopic disease. That means the spread of cancer that exists beyond the main tumor or the primary lesion. These are sometimes microscopic. The surgeon cannot see them. You would not use a microscope to see them. Obviously, it would be impractical, but there's a way of eliminating that. When you eliminate that with minimal force, then you not only eliminate that threat, but you confine the primary lesion, which is the tumor. Once it gets confined, then it's easier now to ablate it, to remove it. If you get clear margins, most likely, the patient is clear of the cancer for good. This is the best condition. And then for the follow-up, obviously, because there can be some circumstances that might promote the coming back of the cancer or might predispose it, then you use a program. The programs are usually hormonal, it's one of them, but also can be diet, could be support metabolic, could be supplemental, and many others. This is why we have to integrate all of the means that we have and that we know that has been successful in the past, and that may contribute to the better results in the long term for the patient. We like to work in places, holistic care, for example, is one of them, that provides this back support, and the patients usually get practically everything that they need, to not only support them symptomatically, but metabolically, and also is going to project them, with a much better future, in the years to come.